Welcome to episode 7 of the Sink or Swim podcast.
Episode 7, you said?
Episode 7.
Wow.
We are continuing our specialty series, whatever you want to call it, where we talk to different students that applied successfully to different specialties.
Different members of the charter class.
Different members of the class
This
of
is special.
2022.
Yes.
Our class, the charter class, the inaugural class. Today we have a special guest, soon-to-be Dr. Kyle Huntley.
Kyle Huntley!
It's very nice having you here, man.
Welcome.
Hi. Yeah,
Hi.
I'm very excited to be here and happy to share this moment with you guys and talk a little bit more about what led me to orthopedics.
Kyle, we're so happy to have you. I got to tell you, when you opened your envelope on stage, I nearly cried.
I think everybody.
I think my mom cried too.
That picture of your mom, oh my gosh.
Yeah, your family reacted really authentic.
It was
beautiful.
It was
Yeah.
beautiful.
It was beautiful. And you decided to open your envelope fresh on the stage. You didn't know what to expect. And this is interesting because you parallel applied, which we'll get into later.
Yeah.
So you didn't know what you were going into or where you were going.
That was exciting, and I think you guys talked about in the last episode how our match day worked. We were given a choice whether to open it in private, just us, just the students, and take a peek, or open it on stage and live with everybody. I decided to open it live on stage, and I had no idea. I dual applied. I had no idea what it was going to end up being, but I just felt like, I owed it to my mom and my girlfriend and everybody that came here to share that moment with them, and whatever it was, I knew that I had that support system there, and luckily it worked out.
And you applied to orthopedic surgery, just for clarification,
Yes,
right?
yes. So I applied to orthopedic surgery, and I matched at my number 1, and I'm going to be going to the Ohio State University for the next 5 years in Columbus, Ohio.
Oh my gosh. Do they have a saying? Do they have a thing where they go, oh, hi? They go, what's high in the middle, round on both sides? High? No?
I'm still learning.
Okay.
I know it's a huge campus, huge state school with good football program, good athletics, that college town feel, which was something I was really, really looking for. I did my undergrad at UF, and I really kind of fell in love with that environment. So that really helped me put Ohio State as my number 1, kind of be in that collegiate atmosphere where you still get a great education and then can still have fun and have that wellness with your co-residents outside and, enjoy the things that make you happy.
I know Ohio State really likes to say the Ohio State.
They do.
They put a huge emphasis on.
Oh, is that what they say? It's
yeah,
the Ohio State?
Ohio State.
The Ohio State.
Yeah, and
Wow.
the is capitalized.
Oh, is
so,
it?
With the
Okay.
T,
They're
the
really
T,
into
yeah.
it.
They're really into it.
Yeah.
Beautiful area, I hear. I watched this episode of, I watch on BBC this beautiful show called Aerial America, where they do aerial tours of each state. I watched
Really?
the Ohio one before my interview, just to get an idea of what Ohio looked like, and it looks really beautiful, especially the Columbus area. So I'm very, very excited for you.
Thank you. Yeah, I did my month rotation there, so I got a little taste, but, I'm really excited to be there for 5 years and see where that takes me after. And
that was your number 1.
That was my number 1
And you got your
choice.
number 1 orthopedics choice.
Yes.
Wow.
And
You're going to have to tell us all the
I'm
recipe
humbled.
to that.
I don't know if there's a recipe, but
I
I can
think-
try my best.
Yeah, I think trying to figure out what the recipe may be or parts of it is important, because I feel like orthopedic surgery in particular is something a lot of medical students, maybe they don't end up applying to ortho, but it's something they're like, man, maybe I could do ortho. That sounds really interesting. And a lot of people, it just sounds cool. You're fixing people's broken bones, and a lot of your patients are young. I don't know about most, but a lot of the injuries are accidents. So
Yeah.
it's a very unique specialty.
Yeah.
Especially going to a place that you're going, and the things that you wanted out of your place was, a sports team, the collegiate sort of feel that, it seems like that would go hand in hand with orthopedics, which is pretty cool.
Yeah, no, I think that they have fantastic opportunities there. I wanted to be in an academic setting a little bit more because I do like doing research, and I still like having those opportunities. And then like you said, you really just mix in the whole atmosphere of the area, so it made it really an easy choice. And when I rotated there, I fell in love with the residents, the faculty, and it just was the whole package. And I'm just honored and humbled to have made it this far.
Yeah, and on top of how neat orthopedic surgery is just as a field, I think it's also kind of a nebulous thing for medical students because it's notoriously hard to get into, or maybe competitive is a better word, and a lot of people are intimidated by that. So I think just talking about your journey there will be really helpful.
I believe when you just said now that you like to do research, I'm going to tell you why. Because I remember at the very first RISE conference we had, your project was the best one that I heard that day. It was really cool what you guys were doing.
Thank you.
With
Thank
the
you.
pig hearts.
I remember that.
Yes.
I remember it, and I remember being blown away. Like, wow, I'm really in med school. We have this kid up here doing like legitimate research and talking about it so confidently
Wasn't
and
too kind.
beautifully.
It was like MRIs of hearts, right?
Yeah. So I did, in between my M1 and M2 year, I did an 8-week research, internship type of deal, unpaid internship at the University of Miami, where we did some cardiology research on pig hearts and kind of just learning the connection between, kidney failure and heart failure with preserved ejection fraction. So my job there was to basically just analyze the heart MRIs and kind of just see if there really was an effect on the kidney failure and our heart failure with preserved ejection fraction, and just kind of correlate those two numbers. And I had a chance to present that at our medical school's first ever research conference, and I won the prize, or not the prize, the first overall in research presentation, which I'm still humbled about, and I'm somewhat still surprised, but
I'm not surprised at all.
It was a cool experience, and that's what I would say too. Is I wasn't orthopedic surgery from the start. I had a very, very open mind, and I think that's what allowed me to be confident about my choice in orthopedic surgeries, because I was able to try everything. I did cardiology. I loved it, but maybe it wasn't necessarily for me in the end. And I did other research that I'm sure we can talk about later, and like things like allergy and epidemiology, immunology, and that's what really made me feel confident about my choice in orthopedics too, because I tried everything.
And I think that that's really important for students to understand, because you're saying that you were interested in orthopedics from the start.
No.
Oh, you were not.
I was not.
I mean, I was interested in everything. Was my problem.
Well,
so,
I think
It's not a problem. That's a great problem to have.
that
yeah.
was my problem.
Keeps
I
a
liked
curious mind.
everything.
You know how I know you were ortho from the get-go?
Tell me.
Square jawline.
Oh, thank you.
Nice
I don't know.
job.
It's a nice cut jawline.
Trying to grow a beard. I don't know.
Don't hide that jawline.
You're too nice, Sam.
It's part of the
Part of the ortho?
Yeah, it's part of the ortho crew.
Well, I think what I was trying to say is just that doing research early on in any specialty, as long as it's meaningful and you're gaining a lot of experience out of it, is fine. You did cardiology research, you successfully matched ortho at a great program. Eventually, you said you did all these varied types of research projects. It's not going to hinder you from going to a specialty like orthopedic surgery just because you're doing a research project in a different field.
Yeah, and that's what I've noticed too, is that even on the interview trail, like you don't have to have 50 lines of research in orthopedics or anything like that. Just do a project that you're passionate about and can talk about. During COVID, a couple of classmates and myself did COVID epidemiology research, which we were fortunate to have it published in the American Journal of Epidemiology. That has nothing to do with orthopedics whatsoever, but I was able to talk about that on every single interview and just say, hey, this is a project that I helped lead from the start, and they just want to see that you're able to go through that process and see a project through to completion.
Yep.
No matter what it is.
Because that translates to you being able to do future research in their program.
Exactly. And I think that's really something important to keep in mind, that just, do something with your time, no matter what it is, and do something that interests you and something that you can talk about. I mean, of course, it doesn't hurt to have, orthopedic research, and I was fortunate to have a couple of papers, review papers in orthopedic surgery, which I was also able to talk about. But if you're just looking to get started as an M1, M2, and orthopedics, or maybe even not orthopedics, like, get involved in something.
Yeah, do something for
do
sure.
something so that you learn the research process and can talk about it on interviews.
And
that's really important.
I think you keep mentioning something you're able to talk about, and what that means, and I felt the exact same way, is that when you're in interviews with different programs, they're going to ask you, oh, I saw that you were on this project with XYZ. Can you tell me about it? And if you're able to talk eloquently about like what, how that project started, how you saw it through to completion, like you said, that's that speaks a lot about your research capabilities and you as a student.
Exactly. Yeah. Just make sure that when you're interviewing at these programs that you emphasize that, like, I was very interested in this. I helped, like, say what you did specifically in it. I helped lead it. I submitted it. I was the primary author. I drafted everything up. Like, whatever it is, make sure that you emphasize that and say, and how it's going to help you in the future when you go to that residency program. Say, oh, I noticed you guys like to do research and I'd like to get involved in these projects. I thought it was very important to, that's just one data point on your application. Like I said, they're not going to scour over your lines of research, but they want to know how you're going to talk about it in the interview and why it was important to you.
And being able to speak about it is great. Like I mentioned in our research episode, I've only done one project, but the same thing for 2 straight years. And it was it was brought up a lot during interviews. So Kyle's absolutely right. Something you can speak about passionately, and yeah, you'll be fine.
Yeah, and
Yeah.
I was internal medicine. Most of mine was in emergency medicine, a little like 1 paper on trauma surgery and 2 epidemiology. Nothing
Yeah.
to do with internal medicine, nothing to do with cardiology, which is like what I'm planning on doing. And it was still something I could talk about on interviews.
Yeah.
So I know we kind of went down like the research tangent, but let's back it up maybe a little bit and
course.
talk about you.
Let's talk about young Kyle.
Definitely young Kyle.
Young Kyle.
Let's talk about young Kyle. I know one thing. I know your parents are from New York.
Yes. My mom is from Brooklyn. I come
mom's
from a
from
very
Brooklyn.
Italian family, but I don't know what happened to me because I'm not really that Italian. I talk with my hands, but that's about as far as it goes. I kind of like spaghetti. Chicken parm is one of my favorite foods, but other than that, that's why I'm not really that great of an Italian or a New Yorker. But
I can take you to a good pasta restaurant if you want to find your Italian again.
I would love to.
It's called Spaghetto. It's a little factory that the guy from Italy has. It's on Davie. It's like on 84.
I'm gonna need that.
It's pretty fantastic. You should take Ashley there.
Yes, before we leave.
They make fresh pasta. It's a factory.
We went.
and
It's
you
pretty
just-
nice.
It's pretty great.
I'm gonna need that recommendation. Definitely, yeah.
You can find the Italian within you, and you'll realize it's not all chicken parm and spaghetti.
I mean,
Kyle,
nothing wrong
shame
with-
on you.
Nothing wrong with that. But so my family's from New York, but I grew up my whole entire life in South Florida, in Parkland, Coral Springs area. It's just like a suburb of Fort Lauderdale. And in high school, I was just very interested in chemistry. And then I went to the University of Florida, and that's what I majored in was biochemistry, and that kind of opened me the world of medicine in general, how the body interacts and how all these disease processes happen. And it really got me interested in the basic sciences, and that's really why I applied to medical school, just kind of getting that exposure to science. While I was at the University of Florida, though, I think a really big moment for me was I got my EMT license in between my sophomore and junior year at UF. I did like an accelerated 5-month program, whatever it was, and I thought it was just so valuable, even in medical school, to kind of have that background knowledge already of BLS, disease process, how to acutely manage some patients. And after I got my EMT license, I worked as an EMT. I volunteered as an EMT in a very, very rural county in Florida for about 2.5 years until I graduated, and that was just an incredible experience. Just kind of seeing patients in their homes and also getting your hands dirty in medicine before I went to medical school.
Yeah, we did the same exact thing between sophomore and junior year. Got the EMT license, worked for a few years before med school. I completely agree. Like totally invaluable experience and so much fun.
Yeah. I think that if you guys have an opportunity, so I wasn't big into research at this point in undergrad. I wanted to get my hands dirty right on medicine and do something cool like being an EMT. So there's multiple routes to go. I know some people in undergrad now, I know how competitive it is to get into medical school, are pushing doing research in undergrad. But if that's not your thing, I thought the EMT route was a fantastic option, and it gave me something to talk about too in all my interviews, I'm sure, with you too, Mitch.
Yeah, I also had no research going into med
Me
school.
neither.
That was the backbone. Like that and playing football. Those were my 2 things that separated me in a way.
Yeah.
From an admission standpoint, at least here, so just at our school, what I've noticed is that a very robust clinical experience will get you a lot farther than research.
Yeah.
It's nice to have both, but if you can only have one,
Yeah.
I
they
think the
to have
clinical
that.
experience is key, especially something that you guys had done, like an actual job.
Yeah.
That's impressive.
Yeah, it was nice, and it gives, like I said, back to the even the residency interviews, and medical school interviews, if they're pre-meds listening to this, just give the admissions committee something to talk about, just something interesting that you can talk about. My EMT experience was something I didn't have research or publications to talk about, but I talked about my time on the ambulance, being in a very, very rural, underserved area of Florida, and kind of how that opened my mind to things, and made sure that medicine really was it for me. So
EMT particular is really cool because you're seeing patients even at BLS level at kind of the lower end of the totem pole, but you're getting a feel for what it's like to assess a patient and like treat them in some way, even if minimally. And then even interacting with nurses and doctors in the ER, it's a very cool experience. It's like shadowing, but also providing some patient care.
Yeah, you get the flow of how things work too. And then when you are in your third year, fourth year of medical school, you kind of, you gain an appreciation for when they bring people in on EMS, and like you get an idea of what's going on, beforehand. So that was really my college experience. I didn't do too much else. I was able to, do like an observership shadowing with an anesthesiologist while I was at UF, which was also really cool and gave me that early exposure to anesthesia, which I still, do have an interest in. But after that, I applied to medical school, and I had the opportunity to be the charter class at Nova Southeastern's new MD program, which is, 30, 40 minutes away from, my family home.
That's great for you.
Yeah, so it was an awesome opportunity, come home and, have that support system really, really close to me. And I'm a South Florida kid, and I've been here my whole life, and it was just awesome to come back and, be a part of this.
We ask everybody this, but do you remember when you got your the acceptance letter?
Yes.
What were you doing?
Yes, I do.
Everyone does.
Everybody remembers.
So I remember it was actually on my sister's birthday. But I was at UF. I was a chemistry tutor for the University Athletic Association.
So that means you tutored athletes.
Yes, I did.
That's pretty cool.
Yeah,
You
it
would've
was
tutored
really cool.
someone like you, Mitch.
Yeah.
Gotten you to the 3.0 club.
Yeah, that was.
I haven't told you about that yet.
No,
We had like in the football team, like, because athletes aren't usually great. We had like a 3.0 club. If you had over 3.0, you got a T-shirt. It's pretty prestigious.
Mitch made it into the club.
Yeah.
I'm sure
Obviously,
he did.
he's
Look
here.
at him. Yeah, of course. Smart. One of the smartest kids in our entire class, right here. With
Please go on about your
That's
tutoring.
subjective.
Sorry.
Yeah, that's a subjective opinion.
No. Yeah, so I had the chance to be a chemistry and biology tutor for the University Athletic Association. Again, really cool.
What
awesome
kind of chemistry,
experience.
though? Just I'm sorry, I'm throwing you off here.
Yeah.
Are you an O-Chem or a
So I
Gen
did-
Chem person?
So I started off in biology, and then my senior year, I kind of worked my way up. So I did this for like 3.5 years at UF. My senior year at UF, they moved me up to like head chemistry tutor almost, where I didn't really have like specific students like I did the previous years. Like they would assign me, somebody from the swimming team, somebody from that. You're going to help them with their biology class, whatever. My senior year, they just said, you're the chemistry guy. You're going to have 2 hours of office hours per week or 4 hours office hours per week, whatever it was. And people are just going to come in and ask you questions about any chemistry class.
Oh, wow. Okay.
So that was really cool.
Cool.
And then there was a couple students that came every week, and I was like, yeah, of course, like we'll do a private tutoring session. I mean, they weren't, paying me or anything, so I'll do whatever I can do to help the athletes. So anyway, back to the medical school story. I found out at noon, and I had a tutoring session that also started at noon. So as soon as my student walks in, I get a buzz on my phone, and I look through, and I see the acceptance email. And the student I was with, you could see like something was like, I was just happy about something. He was like, hey, what's going on, man? I was like, yeah, I just got accepted to medical school. And he was so happy for me, and it was awesome. But we did the whole hour, so I had to kind of contain myself. So I had to contain myself for the whole entire hour.
What kind of
after
athlete
that.
was this? Just
He was a football player.
a football player. So
Yeah,
he
but
was probably super happy for you.
yeah,
Yeah.
he was awesome. So the athletes I worked with, I can't say enough about how amazing they all were, and the University of Florida, the way that they structure how they have student tutors to help the student athletes. It was an amazing experience too, and again something to
That's
talk
cool.
about.
That's a cool experience to have.
Yeah,
I like that you've done that.
yeah, it helped me with the basic sciences even coming into medical school because they say you learn best by teaching somebody.
Absolutely. Yep.
So that was really cool. So I had to contain myself for an hour, and then I went back to my house, called my mom, everything.
Oh, I bet she was so excited.
Yeah, my mom's a teacher, so she was in the middle of teaching, and she was like, yeah. But yeah, and then it was all history from there.
Okay, and then here you were. And I remember you were in my PI, Professional Immersion group, which is the first thing you start when you get here at NSUMD. What do we even do in there?
It was. I always thought
We
of
read
it
a
as,
book.
It's like a 2-week orientation.
Yeah.
That's beautiful.
That's what I've always
Yes,
called
it's a 2-week orientation, and Kyle was in my group.
Yes.
And I remember Kyle has had, or maybe has or had, a penchant for fast food. And so
I love Chick-fil-A, yes.
I know you do.
Admittedly.
So I would ask you your order, and you would tell me your order.
Yes.
Yeah.
The Chick-fil-A, you need a spicy sandwich meal.
Okay.
Large with a Coke.
Okay.
Number 3.
You don't add cheese to it?
No cheese, just the plain pickles.
What about a slice of American cheese? Add some creaminess.
No.
No?
I
Okay.
like you
I
can't
agree.
smother the
You
chicken.
got to be a purist with the
Yeah.
chicken sandwiches.
But
I feel like you should put a slice of American cheese on it to add creaminess to the spice, but
well, you know what, maybe next time.
maybe that's
today I'll
just
go.
me. You know?
I used to work at Chick-fil-A, you know.
Yeah,
Really? I
Mitch
didn't
used
know
to
that.
work at Chick-fil-A.
That's
Yeah.
why he's so nice.
My
Yeah,
pleasure.
Yeah, is it your pleasure to
Yeah.
be here? Are we even allowed to be saying their name?
It's like trademark.
Gee, Chick-fil-A.
The spicy deluxe comes with pepper jack cheese, which is
Wow.
very good. It's
I
good
get a
addition.
regular, but not. I mean, like I get a regular spicy, but I add a slice of American cheese.
I
might have
respect
to do
that, but
Try it.
Yeah.
Try it. It's something different, you know.
Yeah.
It's like I'm pretty much a chef here.
Yes.
Yeah.
I can
so
tell.
you're here, you're deep in professional immersion, you're eating spicy chicken sandwiches. How does the first block of fundamentals go for you?
Jesus.
A very troubling time for all of us.
So fundamentals. So we had kind of two challenges. We were first week of medical, first month, whatever, first real block of medical school, which is going to be challenging for any sort of medical student. I mean,
just inherently. Yeah.
just the step up from college. I think it really. I mean, I'm sure you guys have heard the analogies, drinking through fire hose, whatever it is, but it really does hit you like a ton of bricks. Where just that step up from undergrad, you're like, wow, I need to know all of this knowledge. So we had that challenge, and then coming in as the charter class, and this was the first ever block that they've put on too. So of course it had its challenges really with the structure and maybe some of the professors getting used to what we need to know, fitting it into our blocks and
Because these
structuring.
professors, just for clarity, they also were teaching for the osteopathic program. They were also teaching for the dental program,
Yeah.
the PT, all the different programs. They had already had these set lectures. And then we
Yeah.
come in with guess what? We're doing PBL, and these lectures are 50 minutes. So,
Yeah.
adjust accordingly.
There was some strife at the beginning.
Yeah, there
Yeah.
was some conflict in ideologies, maybe.
Yeah.
Yeah.
So
All
it
of
was-
which has been smoothed out.
Yes, it has, and I mean, when we decided to come and be the charter class at this new MD school, I mean that we signed up for that. We knew that there was going to be, some challenges, but I think you kind of alluded to it where we also had some opportunities to, shape the block going forward. So like, even though it might have been a little bit more challenging for us, we know that now the M1s it's much more smooth because of the feedback that we gave and the
I've gone
suggestions
to a
we
few of the
made.
lectures, and they really did listen to our feedback.
Exactly.
They're taught. Most of them are dual taught by a PhD and a clinician.
Yeah.
Which is really cool.
That is really cool.
They're shaped to the 50 minutes. They're
Perfect.
like little stories. They're doing good. They listen to the feedback for sure.
Perfect. Yeah.
Don't ask me why I showed up as an M4 just to a lecture, but
nostalgia.
De Leon.
Well, you like medical education too.
Yeah.
So going to a lecture every now and then to see how it's changed, there's nothing wrong with that.
Okay, good.
I've thought of, I haven't done it, but I think it would be cool just to like sit in a PBL session and watch and just like get that perspective or having that perspective now and just seeing how they do it.
I pushed so hard, and if anybody's listening to this, Dr. Ely, I know you're not, but if you are, Dr. Griffin, I know you're not, but if you are, let me be a PBL leader, facilitator,
You'd be
please.
great at it.
It's too late now. The last block has started.
Are they on IQ now or something?
Yeah, they started IQ,
I liked IQ.
and they just started CPR today. No,
Oh.
Monday.
Oh, exciting.
Yeah.
Oh, that means our EKG lecture's coming up.
Yeah, you better
Me
show
and Justin
up.
Marks and Miguel.
Oh, you do a thing?
Yeah.
Oh,
Yeah,
good for
Mitch
you,
is our
man.
EKG pro professional.
Dude, there's some EKG pros under us too, man.
Yeah, I loved EKGs. I don't know. I still love it, even though I'm unfortunately never gonna have to wear a stethoscope again.
I was gonna say the
Funny.
ortho guy saying he loves
You know-
EKGs is beautiful.
Do you
I mean, I
remember-
love it. That's just how my mind thinks. I love the process of things and not just looking at an EKG and recognizing a pattern and saying, okay, whatever, this is VFib, VTAC, whatever it is. I like understanding why where there's a depression or what the spike stands for and everything. That's just kind of how my mind works, and I really like that.
And you said you're interested in cardiology too, so you
I
have
was,
a
yeah.
bigger appreciation.
Do you remember Dr. Daniel Chan, the orthopedic surgeon from
I do.
Memorial that came in to lecture us?
Maybe this is
He was really nice.
time.
Really cool guy.
yeah.
He said, and this stuck with me. He said during the lecture, he said, orthopedic surgeons are like the smartest medical students, but we are the dumbest doctors, I tell you. So now you're not going to even know what an EKG is anymore.
It's gonna slowly slip out of my mind, but I hope to still stay up to date on all this stuff. I mean, just who I am as a person, even going back to undergrad. Like I just love, even with the chemistry, understanding how things work, not just why things are the way they are. So even in residency, I'm gonna try to make it a point to
No, I believe it. I believe
not
you, Kyle.
try to let some of this knowledge slip out of my mind.
I
That
think
spent
you'll
so
be
much
good.
Time.
You'll be good
Thank you.
if there's an emergency on a plane.
Yeah.
I'll call Sam.
10 or 12 years from now, you should handle it.
Yeah, you'll become a master of, because ortho is, I guess any surgery is more of like a craft, and that it's like a lot of technical skill and their procedures, but you could also still have a broad understanding of medicine and keep that up to an extent.
Yeah, and what I've noticed about orthopedics is that you still have to very much understand the why about why things happen and certain processes. I think it's a lot more physics and, like mechanics than people really understand in orthopedic surgery, with like stress risers and, you got to have the right tension and movement and angles and things like that. I think the physics aspect was really awesome for me because I did like that when I was studying in undergrad and even for the MCAT.
This is the best part of the MCAT.
Was the physics?
Yeah.
I didn't think so at the time, but now I do.
Yeah.
Looking back, it was pretty cool.
Physics is a great subject. Everybody should respect it more than they do, especially in medicine.
I remember not appreciating it as much as I should have going through it. I knew that I liked parts of it, but I wasn't even like super serious about my studies yet, so I was like, whatever. But looking back, man, that was such a fascinating subject. I wish I would have taken it more seriously.
Yeah, it's I can see where the first half of it, when you take like generally physics 1, is your mechanics type things, pushing a box up an angled floor.
Even that stuff, though.
Yeah.
It's so cool. It's
It's
like how
pretty
stuff
neat.
works.
Yeah.
Like how does stuff move?
And then when you get to the second part, you start to get more into the how the nucleus works, which is really neat. So
Yeah.
So
fun stuff.
so
fundamentals. Let's talk about it.
you got through it, obviously, but how was that? I guess you can kind of lump it all together in that, like, step 1 is the first huge milestone. Maybe getting through fundamentals is the first huge milestone, and then after that, it's leading up to step 1.
Yeah. So I really enjoyed, those first 2 years of medical school, and I mean, it was like we talked about, a huge learning curve that you got to get through. But I mean, studying for step 1 was a challenge, I think, for anybody. I mean, it's now pass fail, which hopefully should take some stress off, at least for the dedicated period. But those 8 weeks were tough, going through UWorld, and doing all that. But lucky to have gotten through it, and yeah, not too much going on with the first 2 years. You just got to memorize. No, it's a huge learning curve. We've all done it. Just find something that works for you. I mean, whatever process, if you use Boards and Beyond, Pathoma, if you like reading textbooks, if you like going to lecture, just find something that works for you and stick with it. You don't buy 16 different textbooks and try to read them all. Find one thing that works for you and use that to get through your first years and adjust as necessary. If you don't do well in your exam, adjust something.
Yeah.
So what worked for you? What was your process?
So my process was I did Boards and Beyond first as like a
Shout out Dr. Ryan.
Boards and Beyond or Pathoma, depending on really what the topic was. If it was like more just physiology based or basic science based, I would do Boards and Beyond. But if it was more just like disease processes that I need to know, then I would do Pathoma. But either way, I would do either one of those videos and take my own notes on it. And then I would read or skim through like the corresponding textbook chapter with a textbook that works for you. I loved Costanzo and then Robbins sometimes. And then I would take my notes that I had from Boards and Beyond or Pathoma and just kind of supplement them by reading through Costanzo or Robbins. So if there was something that Pathoma, kind of skimmed over, but I think I should know more detail about it, I would, annotate that and say, okay, this is
Fill in the gaps.
fill in the gaps.
Okay.
And then with Boards and Beyond, I would take my own notes on like loose leaf paper and then read Costanzo. Physiology. It's a physiology textbook that I think puts things just super clearly with just enough detail you need to know, and then kind of fill in the blanks there, and then just study my notes.
And would you use any sort of like recall, flash-based space repetition to like glue it together, I guess?
Anki.
Okay.
Yeah, so I didn't get into Anki until really my second year of medical school when I started ramping up for, step 1 studying. I don't think it was super important for, just the medical school exams going through. Like, if you don't have the time, I mean, you're really trying to catch up with all this stuff anyway. You don't need to dedicate, unless it works for you, the 2-3 hours a day necessary for Anki. But once we got to the second year, ramping up to step 1, then I started to slowly integrate Anki into my studying because I knew it would help me during dedicated with the recall. And I really do think that Anki played a big part in step one success, because a lot of times step one, you're moving so fast through those 50 questions, and sometimes it's just that one buzzword that's all you need to hear to lead you to an answer. At least cut it in half and say it's either one of these two, just because I know.
That's a good point you bring up. People should listen to that. That's a good point I haven't heard anybody bring up.
So
did you do practice questions leading up, all
Yeah.
throughout year 1, year 2? Did you use?
I saved UWorld for step one,
Okay.
and then I can't remember what I used for
The RX, USMLE RX,
maybe
or
USMLE
Kaplan.
RX or Kaplan. I can't remember, but
They
I
have
used
Amboss
one.
now, which
Amboss
is great.
is fantastic.
Yeah.
So I plan on using Amboss even when I'm in residency.
Oh,
not
yeah, me too.
For the clinical knowledge lookup.
100%.
Oh yeah.
It's
Yeah,
fantastic.
yeah.
It's worth the subscription, even if you don't do the one with the study questions. It's really cheap just for the knowledge base.
Yeah.
Oh, yeah.
The QBank is great, but I don't think we need the QBank anymore.
No.
No.
I think most people just use UWorld for step 3, and that's plenty. But as far as the learning library, man, it's
It's
Oh,
fantastic.
the clinician mode too, and you
It's
know
the
every
clinician
how to treat. Yeah. Shout out Amboss.
Shout
They're
out
not
Amboss,
sponsoring us, but I highly recommend it. They sent me socks.
yeah. Disclaimer:
Yeah.
They did send you socks.
Yeah.
Disclaimer.
Did they not
Financial
send you
disclosure.
socks? I don't know
But,
why they said.
yeah,
They just said Happy Match Day. Here's some socks.
That's awesome. I
Yeah.
didn't get my socks.
Me
I'm gonna
neither.
look for those. But yeah, no, Amboss is
Sucks to
fantastic.
suck.
We actually, as a class, discovered it pretty late, I think.
I don't think it was actually popular in the States when we started in 2018. It didn't become really here until 2019-ish.
Yeah.
Yeah.
So halfway, into our second year, I think that's when for like IQ and towards the end of PBL. It's really good for medical school too. If you just want the quick hits on something, you don't have to do clinician mode, but just if you really need to learn a topic in like 30 minutes or just want to understand it better, instead of opening Robbins or opening another textbook, just read the Amboss page, and I think it was very, very
Yeah.
helpful.
I
So
loved it
integrate
for
that.
third year. I used it in clinician mode for third year, right when clinician mode came out. And you could write up your plans for your presentations.
Amboss and up to
Like,
date.
how'd you know that?
Yeah. Amboss and up to date was everything I
great,
used.
too. Yeah. So that was step one. I blew through UWorld.
And just so people know, for orthopedics, step 1, and this is obsolete now after the next match happens. You have to have a really good step 1 score. So take Kyle's advice. Do what he did.
So I was fortunate to do well on step 1, but now I think step 2 is really where they're gonna kick the can further down the road. So maybe focus on that if you're listening and interested in orthopedic surgery or any other historically competitive field. What I will say though about orthopedics is that once you get to a certain point, your step scores don't matter.
That's what I figured. You have
Yeah.
to. It's a fit thing.
It is.
With each program individually. And I think a lot of people forget this when they're applying for residency. I know I even had moments of forgetting this, but having been on admissions for the past year, I realized that the programs know their fits better than you think they do. So
Yeah.
they know who they're gonna want to interview. They know what their future classes are gonna look like, and you just kind of have to relinquish control and accept that fate.
Yeah.
And cast a wide net and then go from there. But trust that the programs, they've been doing this, they do this for a living, they know their fits.
Yeah.
So
My limited experience with that is for sure echoes that 100%. Is when I did my emergency medicine away at Orlando Health, the 2 girls that were on my team for the month that were just the most hardworking, down to earth, got along great with everybody, they ended up matching there, and no one else did that I rotated with, and everyone wanted to go there. I think you're 100% right. If you're doing it away and it doesn't matter what your scores are, what your research is, if you go somewhere and they don't like you, you will not match there.
Yeah, and I can talk about that a little bit too, because I think especially with orthopedics, so pre-COVID, they wanted you to do, as many away rotations as possible for that very reason, just because interviews sometimes are hard to come by and you can really show yourself off and sell yourself there. But yeah, I think that doing away rotations for orthopedics now that, hopefully things are back to normal, take advantage of that time, do your away rotations. And like Mitch said, just, be yourself, because they're not just, interviewing you, you're interviewing them too at the end of the day too. Like, you don't want to go somewhere, based on, prestige or what you think you want. Like, go there and immerse yourself in it and say, I could see myself there. And then if they want you there, then, it's a perfect match. I guess that's why they call it that. But
And
yeah.
I couldn't have said it better. One thing I definitely want to get into before we move into like the third year, which then inevitably gets to applications and all that goes with that, is when did you have your first exposure to orthopedic surgery where it was something that came on your radar and you're like, man, this is something I might actually want to do?
Definitely.
Because you said you liked everything.
Yeah, so
so
it's an
how
interesting
was
story.
third year for you? Like, how did that go?
So, yeah, I went into third year after step one, still without an absolute clue. Really, I had certain interests. I always thought orthopedics was just cool, just, hearing about it. I mean, you're going in there
I don't think anybody
fixing
thinks
things.
it's not cool.
Yeah,
It's really cool.
The coolest instruments, like awesome patients that you get to help, and you get to help somebody instantly. But so third year, I still didn't really know what I wanted to do. I came into medical school really wanting to do emergency medicine, kind of drifted away from that.
Because of your background?
I mean, a little bit. That kind of what drew me into it a little bit. But I also wanted something that I could see myself maybe doing when I'm like 50, 60 years old, where I don't know if I really want to be doing, the 12-hour shifts and anything like that. I wanted, that opportunity to have a more normal schedule.
Mm-hmm.
But I mean, some people that works for them. It was just something that I could see and that I didn't know if I was super thrilled about looking that far down the line. But I still think it's an incredible specialty. And you learn so much, and there's some of the most amazing physicians that can do the most. But yeah, those are kind of just some of the thoughts I had going into third year. Like, I love that. Cardiology was really cool. Internal medicine was really cool. Anesthesia was really cool. I had experience in that. But
Sorry, not to cut you off, but do you think you're interested in everything just because of like how you are as a person? Like, are you just like naturally curious? Because I mean, I think that's why Sam and I like everything. It's just because we like to learn. Like, genuinely, we like hearing about stuff. So
I think it's that. Yeah, I think it's that. I'm just a very curious person. I like to understand why things work, and you put yourself through medical school, through 4 years of intense schooling. Like, don't you want to learn the most you possibly can about everything? Like, you're a doctor. Like, you should at least have some knowledge.
We've said the exact same thing.
Like, you should at least have some knowledge in everything. Like, you don't have to be, a radiologist, for example. You should know how to, read an X-ray or what shows up on a CT scan, or you should know how to read an EKG, or at least be familiar with it.
You should care and learn about things just for the sake of learning it, because you're a doctor.
Exactly.
It's your job.
Med school's competitive, and getting in is a gift. I mean, hey, you can have a perfect MCAT and all that, but it's like Dr. De Leon was saying, there's at least 5, 10, and what I've seen, there's hundreds of people who are better than you.
Yeah.
So getting in is a gift. Do something with that gift. It's a privilege. You go and you learn every day as much as you can when you're there, and give that gift justice.
I think that humility will serve you well in your career too, no matter what you go into. But so you went into third year not really knowing.
Not really knowing what to do, and then I came across the field of orthopedics, which I love. I still loved internal medicine and, thinking like that. And I came to realize there's a field called musculoskeletal orthopedic oncology or surgery. So basically you operate on people with bone cancer, like sarcomas. So you get the orthopedics, and you also get, kind of like that medicine side of dealing with oncology and cancer.
Where did you hear about this?
So I just did some research on it. I was like, orthopedics is really cool. Let me see what other fields there are and something that, can kind of pique my interest. And I came across, orthopedic oncology. And I looked into it, and I was like, this is something I could really see myself being interested in. So this is about halfway through third year. And I reached out to some people at some local universities, seeing if I could hop on, some research projects on this very topic to learn more about it. I was fortunate enough to, hop on some projects where it let me take a deep dive into, orthopedic oncology. And I thought it was just the coolest thing. And that kind of opened the door to me for orthopedics. And then from there, I kind of branched out a little bit more. I read more about orthopedics. I had a chance on my general surgery rotation to go into a few orthopedic surgeries, and I got to witness them. And it was just the coolest thing in the world. Some of these surgeons can do. I mean, the instruments, and you get to see these patients be better, immediately. And that kind of is what really did it for me. And then I took even a deeper dive into orthopedics with my away rotations, more research into orthopedics, like publishing papers and things like that, to just kind of give me that full picture. And from there, it was basically set. So I was a little late to discover it, but I mean, I'm very, very glad I did, and I'm confident about my choice because I talked about it, because I did everything, or I saw most of the stuff, and I was like, this is really cool. This is it.
And I think something that the way you're explaining this is really important to understand for students in their, mostly second year, early third year, is the decision of what you want to pursue or the experiences you need to make that decision. They don't just fall into your lap. Like, you really do have to open them up for yourself. You do, like, when I was on OBGYN, I saw my first orthopedic surgeries because I happened to meet an orthopedic surgeon in the hall and just asked if I could go watch surgeries. I saw 2 surgeries and I was like, this isn't for me. And that
I would pass out. I would hear a bone crack.
the
bone saw would come out, the
Yeah.
drill would come out, and I would
the
have to
coolest
leave.
thing.
But prior to that day, I was like, yeah, ortho sounds sick. Maybe I would really like it. But then I saw them and I was
That
like,
sounds sick.
yeah, I'm just being candid. But no, just take those opportunities like Kyle did. Reach out to people. Find research projects that sound interesting. Go shadow somebody.
Yeah.
They might even let you do stuff. It's not like you're a pre-med shadowing. But just go out of your way to get those experiences and make those decisions earlier on if you can, because, then you have a lot of stuff to do after you make that decision, which I'm sure you did.
Yeah.
I saw you doing that all the time. On surgery, on IM, just walking around like a dork
Thank you.
with your back straight. I'll go look at that. I'll go look at that. I'll go do that. I'll go do that.
But do that in medical
It was
school.
so
you know?
cool. Yeah, Mitch is
Take
like,
advantage of it.
and he's so wholesome about it that you don't even get mad.
Yeah.
You can't even get mad at him because it's so cute. He's like, I want to go see that cabbage for 10 hours.
I never watched a
go
Whatever
ahead.
interests
I never watched a cabbage for 10 hours.
Whatever interests you. But no, I mean, I had an underlying interest in orthopedics for a while, like I did with everything I did. Like EMT, you see femur fractures. Even when I was shadowing my anesthesiologist at UF, like I was in orthopedic surgery cases and things like that. So I always had a little bit of an interest in it. And then it was really when I did a deep dive into it in research where I was like, this is really cool and something I could see myself doing. And you really just go in and you fix a problem and you use physics and you use math and you have to think about things in just such a way because you can have just such complex fractures and you're like, how am I going to do this? And you really have to sit down there and think and know which equipment you're going to use and where the stress is going to be and how is this patient going to be when they return to full weight bearing. And it just really was the coolest specialty.
And what point in the timeline? So at what point in third year did you, or even in between third and fourth year, did you solidify, okay, it's going to be ortho?
So it was when I first started working on the research project. I did a research project. It was a review article.
When
so
was
nothing,
that?
This
At
was
what point?
so
do,
it was
you remember like a particular
January.
month?
So
Okay.
January of third year. So halfway through third year.
halfway through third year.
Okay.
But I met my mentor in like December or November. I can't remember, a few years before, and he let me come in and I shadowed him for a little bit in his clinic. And then he was like, yeah, let's do this review article together.
Awesome.
So it was when I started to do that deep dive. It was on fibular tumors and how we, what does the literature say? How should we treat them? It was an interesting topic, and that's what really kind of, solidified my choice because you don't realize how detailed something can be. Something is, seemingly, I guess, from an outside perspective, simple as a benign fibular tumor to, you take that deep dive and you're like, wow, this is really cool and something I could see myself working on. So my initial interest was in orthopedic oncology, and I still do have a strong interest in that. But now I'm back to where I was before, where I'm interested in everything.
That's great.
I had a chance to
That's
rotate
good.
on joints, which was really cool. Foot and ankle, I was like, this is really awesome. And, I mean, I kept an open mind. Spine was cool, so... I mean, I got to see some sports surgery, so now I'm back to square one. We're like,
That's
what
good.
do I want
That's
to do?
great.
That's exactly where you
That's
should be
I was like, what do I
going into
wanna do?
residency.
That's fantastic.
I think
So-
I think this is just good to point out too, in that you successfully matched ortho and you didn't even really commit or think about committing to it till 8 months or so before applications went out, and a lot of stuff happens in those
Yeah.
that
So
half year before applications.
You had to do, obviously, away rotations.
Yeah.
Walk us through the process of you figuring out how to do them, where to do them, how to
Yeah.
apply. What
Basically,
did you do?
the
Yeah,
timeline
so I can
between
do that.
January and applications.
And then just to touch on what Mitch said too, like I didn't discover ortho until 8 months before like applications. However, I was doing stuff before that, like
Right.
the research that we talked about
Okay.
before. Like even if you guys don't know what you want to do something. Get involved in no matter what it is. Even if you want to do some surgery, but you're still not sure, do psych research. Just do something so that when the time comes and you do decide, you still have something on your application.
Mm-hmm.
But so for the away rotations, I forgot what month we applied.
I think
April, March.
April, March. Yeah,
Yeah.
it opened up in April
April.
for applications, or we could view them in March.
Yeah.
Okay.
So I applied, and I wanted to do 3 months of it.
And this is through VSLO,
VSLO.
V-Slow. Okay, which is a double AMC
visiting student
service.
Yeah.
And just for context for us, because we were still in the midst of the COVID pandemic, it was recommended by the COPA guidelines that we only do one away rotation unless your school doesn't offer that specialty.
Exactly.
Which our school did not, because also what I think stacked the odds against you, Kyle, is that you came from a brand new program.
Yeah, and we can talk about that too. Yeah, that was definitely
and here you are, your number one choice in orthopedics, and I'm still beaming from it. So, and I'm not even your mom. But so you log in, you look at places.
So like you said, we had the option of doing one, because we don't have a home orthopedics residency program, but also Orthopedic Surgery, their guidelines even said, look, we want these students, if they're able to do more than one. Because so the program director coalition, I forgot the exact name of it, they said, we know how competitive orthopedics can be. If you're able to do more than one, do more than one. So I did 3. And I applied and I scheduled it. So I did August, September, and November even. So I had a little bit of a break in October. And my one in September was Ohio State, and I was so excited to just get accepted, to do an away rotation there because of those reasons I told you. I didn't really have a true connection to Ohio State or the state of Ohio, but it was something that drew me there. Get out of Florida for a little bit. They still have that big academic feel, like I talked about, in a cool city. So I was like, let's do this. And I was fortunate to, get interviews at those 3 places, and that's why they say doing these away rotations are so important, because as long as you do your work, show that you're there to contribute and learn, you'll get an interview most of the time at where you do an away rotation. And I encourage people to do as many as you can without burning yourself out, because burnout is real, especially in orthopedics. Like, you will be working. You're not just there to, come in at 9 and leave at 4. Like, you will be working, you'll be doing call, you'll be doing weekends. Don't burn yourself out, but do enough that you can, learn about places and try to, show the program, who you are as a person.
It's also inherently stressful leaving your home for a month, going somewhere you've never been.
Finding out where to eat, get groceries
it's
live.
It's almost like moving.
Yeah.
And then you're not moving for a vacation or settling in. You're moving and immediately working very hard.
Very hard.
And
not getting paid to do it.
No. Not to mention the expenses of living in the car or whatever. It's also just stressful because it is a month-long interview. As most people understand, like, you're always on the top of your game, and that's just taxing. Not that it's not a great experience, but it's taxing.
Yeah.
But if anybody can do it, Kyle can do it because it's Kyle.
So my advice and my philosophy with that on my away rotations, work hard. Like you're there to learn, but you're there to also show them like what you're made of and the amount of time you're willing to put in, as long what you're comfortable with.
Let's be concrete. What does it mean to work hard, though? Because that means that's different things for everybody.
You're right.
Some people think that working hard is like gunning.
No, don't gun.
For me, it's just
my
showing
experience,
up.
My experience, don't gun.
No, never, no.
But working hard, in my opinion, is when they say to show up, just show up. Don't be late. Put in the work. Don't complain.
How early do you show up beyond the time?
Depends.
If they say be here at 9, are you showing up at like 7:30 or?
So with the surgeries, you're there at 5:30 in the morning.
Oh, okay. Wait, I am. So
yeah.
Okay.
So work hard, and I mean that by be on time, be attentive, be there to learn. Like
right.
be curious. Don't ask to when can I go home. Don't be inattentive to if somebody's telling you something, if the surgeon's talking about something. Just be curious. Show that you want to learn and you want to be there.
Right.
They like to throw the word gun around. Don't gun. Don't try to answer every question and be like, did you know that? Did you know that? Just be you.
Yeah.
Be a hard worker. Show them that you're serious about, like, if I went here, this is how hard I would work. Your knowledge is. They don't expect you to, be a practicing, attending surgeon or any rotation. I'm sure you guys can say it's very similar. Just, show that you're curious and you want to learn. And that's really it. Stay for your surgeries, and just be happy to be there. But don't be, going crazy. Don't be trying too hard to, show off or do anything. Just be you. And at the same time, you're interviewing them too. If you're not happy being there, go through your month. Like, just go through it, because maybe you'll look back on it and be like, wow, that actually wasn't that bad. And then make that determination, because you're interviewing them just like they're interviewing you.
And it's very true. Be you. And sometimes being yourself is just a full assault to a certain specialty, like Samantha when she was on Gen Surge.
An assault to a specialty. My one of my mentors, I'll have to edit this to make it more like PG, but his advice was that if you want to go somewhere, especially on an away, you have to pass the 3 a.m. test, which is that to pass the 3 a.m. test, you have to like be on call with somebody at 3 a.m. and do they want to be around you at 3 a.m.?
Mm-hmm.
Are they happy? Are they making jokes, laughing with you? Or if something crazy comes in, are you guys able to handle it? You want to be that person that's easy to work with, is hardworking, responsible, takes responsibility, but they're also just like a down-to-earth person who you can make a joke with. You know?
Without a doubt. And I think that's universal across all specialties. And I had the chance to, do call and just kind of vibe with the residents. So going back to even to what we said about, step one in research and everything, there's a certain point where that stuff doesn't matter.
Right.
Because at some point, no matter what the specialty is, you have an interview, everybody's on even playing field at that point. Just be somebody that you're going to be there in that foxhole with them, in that call room for them for 3 years, 5 years, 7 years if you want to do neurosurgery. Just be somebody that, they can be like, yeah, I want to be with them, and then after work, I want to go hang out with them. I want to, meet who they are and just be that person and fit into, whatever culture it is. You don't have to, mold yourself to a certain culture. If it's not a fit, that's why you do an away rotation.
Mm-hmm.
So, when you interview, you'd be like, okay, you know what? It wasn't, a super good fit for me, so maybe it's a little lower because that's the most important thing. You're going to be there for 5 years.
And go ahead.
Practical advice for some M3s about to enter into their rotations. Just off of what Kyle said, you're sitting in the room with them. Don't stare at a resident without saying anything for excessive amounts of time. Don't sit at their computer and do your UWorld. Get off their computers if they need them.
Be cognizant.
Always know if there's a resident, even if they're not on your team, if they're walking into the room, you get out of that chair right away and you move. You go stand somewhere. But don't ever take their computer. Just move.
Yeah, and just to add on, one little tip or disclaimer, I fully agree with everything you said, is how to carry yourself on an away rotation.
Mm-hmm.
And tell me if you agree, is that as far as your attitude and how you come off is very important.
Yeah.
I would err on the side of being more conservative in how you come off on an away rotation, and that you don't want to be too you're not one of the gang yet. You're not one of the residents. You don't need to be making jokes the entire time.
Mm-hmm.
You don't need to be asking them what they're doing after work.
Exactly.
You're not one of them yet.
Exactly.
You are a visiting student, and not that you shouldn't crack a joke every now and then and get along and laugh, but you should err on the side of caution and just be a hardworking team member above all else.
Yeah, no, I 1,000% agree with that. You're a very important part of the team, but you got to look at it from their perspective.
You're an outsider.
You're there for a month. They don't know anything about you. You were picked by you weren't picked by the residents necessarily to be there. Just they're there and they're teaching you, and you know that the residents themselves are overworked and underpaid, and they're also giving you their time. And they don't have to do that. Just be somebody that's just easy to work with and fine to just hang out with, and that's really what they like the most. From my opinion, I'm not a resident yet, but that's what I think just worked the best. Just be you and just be cognizant, like Sam said, of your place and just enjoy the company and be there to learn.
Yeah, don't burden their already burdened.
Yeah, don't burden. You don't want to. You don't want to be the medical student when they come in and be like, oh great, here comes so and just be the one and be like, all right, cool. I'm working with.
Because it's awkward for the residents too. They want to be nice. They don't want to have to tell you to get out of their chair.
Yeah.
So whatever you can do as a med student to make their life easier, whether it's, oh, I forgot to get this question about this patient, you run down and get it.
Yeah.
Or if you want to call the pharmacy, anything that can take the load off of them that's within reason for a medical student to do.
Yeah, exactly.
Don't ask them questions while they're writing their notes unless they've set aside time to go over a note with you. Then you ask questions.
Yeah, self-awareness is so important.
Yeah, I guess that's what we're trying to say. Be self-aware.
Yeah.
Surprisingly, some med students aren't. So, very important.
So, you said you did 2 away rotations, is that
3.
correct?
I did 3.
Okay.
I did 3 away rotations. Maybe I wish things turned out well, but if I could have fit in a 4th, and I would have. If you have time and it fits into your curriculum, I think with something like orthopedics, you should do it. Go out of your comfort zone again. It's intimidating, I guess, for lack of a better term, your first day on an away rotation, especially in a new state, a new program. You're I don't know where anything is. These people are best friends with each other. They don't know who I am. But put yourself outside of that comfort zone, because by the time you get to that 3rd or 4th away rotation, you're going to be a rock star. So just do that. And you learned so much by just being immersed in this. The difference from what I've learned from my first orthopedic rotation through my last was incredible, just by being there.
Yeah, and you're called a sub-I for a reason. Like,
Yeah.
you're meant to be an almost intern,
Yeah.
in your knowledge and work ethic.
Yeah.
A more logistical question, just for like aspiring orthopedic applicants. When would you recommend that students plan to do these up to 4 away rotations, as far as like what months?
Definitely. And I think everybody's curriculums are different. So I think it's important to note that I did step 2 before I did these away rotations. And now I think you kind of have to before interview
for
season.
sure,
Now
yeah.
you have to.
So,
So
I
you gotta
guess
work that
Usually
in.
they'll want a step 1 score, right?
Yeah,
when you
so
apply.
sometimes orthopedic students wouldn't take step 2 until after interviews or after they put their application in to give more time for away rotations. You can't do that anymore. So take step 2.
I mean, I guess we can only speak about our curriculum. When did you take it?
I took it in
May?
July.
July.
Okay.
Yeah, end of July.
Us too, right? We took ours in July.
End of July.
End of
Yeah.
July, like July 30th or something like
Same,
that.
yeah.
And then I started my away rotation.
You said in
that
August,
Monday.
right?
Yeah, so I took
Okay.
step 2 on a Friday, took my first away rotation on
Wow.
Monday. Yeah. Luckily, the away rotation was close by, so I
Okay.
didn't have to,
Good.
excuse me, yeah.
So August, September.
So I did August, September, had a little bit of a break in October, and was done halfway through November, basically.
So then here's an interesting, and I know it's different for IM versus ortho when you're getting interviews.
Yeah.
We get interviews, the second day after,
Oh, no, yeah, we had the
applications are
universal
submitted. You had the
offer
one
day.
day, right?
Yeah, that was
Okay.
stressful.
Could you explain that process?
Yeah, and
So-
I kind of liked it. So what orthopedics does is they have a universal offer day, and like 95% of the programs do this. There's a couple that don't. Where on November 15th, and it'll be different for whatever year it is, on one day at noon, all the programs say we release our interviews, and then you can't accept them until 48 hours later. So it lets you take all your interviews if you're fortunate enough to get a lot of them.
That's so nice.
And say, okay, I'm comfortable with taking just these, however many to match, and then I don't want these, and I'll release them back out. So you have 48 hours to think about which ones you want to take, and then after that, there's another 24-hour period where you can accept them, and then they re-release the ones that people put back. So orthopedics this year was incredibly competitive, and I know it's getting even more competitive every single year. And it was kind of, made even not worse, I don't know if that's the right term, but even more in that direction with the virtual interviews, because people could get 25 interviews and accept all of them because there was no barrier to entry, right? There's no flights, there's no hotels, there's no scheduling conflicts. You can do a morning interview and then an afternoon interview in the same day.
And those are like the logistical caps of like money and travel time and stuff,
Yeah.
but there's not any caps on
virtual.
this, like the
There's
software
no
end.
barrier. So these were just compounded this year, and ortho applicants were up like 20%, like more programs people applying to. So you had just a very small percentage of students getting a lot of interviews and accepting all of them.
I think that was in every specialty.
Yeah, I
to
could
be
see it
honest,
being
that
every
was in
specialty.
every.
Yeah.
I know IM people that got 40, 50 interviews,
And
went on
accept
all
all
of
of
them.
them. Yeah.
So let's talk about the nitty gritties of your application. So those who come behind you
Yeah.
from this school or other schools, if
Yeah.
you're listening, can sort of have an idea of what you did.
Just copy paste his
Just
application.
copy and paste Kyle's application. You apply. With this in mind, knowing, okay, yeah, I have this ortho research. I have, this step 1 score. Typically, these people match ortho, but let me think about this is virtual.
Yeah.
I'm from a brand new med school.
Yeah.
So at what point did you decide to parallel apply, which means you're applying to 2 different specialties as a backup in case you
Yeah.
don't match into your preferred specialty?
Yeah, and that's a great question. And I think, no matter who you are as an applicant, no matter how confident you might think you are into orthopedics, I would highly recommend having a backup plan unless you're okay with doing a prelim year and then reapplying, and then still there's no guarantee.
And that makes it harder in some ways too, right?
Yeah, it makes it
That's it.
harder because they could take an applicant that didn't have a prelim year, and I don't know why I'm not a residency admissions
Right.
committee, but historically they say that if you take a year, it's harder to reapply. and
It's
get
like
in there.
that for med school too.
Yeah,
It's like that
for-
in a lot of things.
Yeah.
It's considered a red flag.
So unless you literally would be just depressed if you couldn't do orthopedic surgery. I love orthopedic surgery, and I'm thrilled that I got it. It was by far my number one. But I didn't want to do that. I wanted to have a backup career that I know I'm stable for, not for myself, but like for my family. I want to. I need a salary at this point.
And you love everything, so that's a good thing for you.
So I dual applied anesthesiology because I still was very interested in that. Like
Which
I
I
said,
could see.
I love chemistry, I love physiology, and I love thinking about things, with that cerebral aspect. And there's still a procedural part of anesthesiology.
And you're a nice guy.
Thank you.
And they're all nice.
They are. I love
gotta be
anesthesia.
nice. Yeah.
Jawline.
Well, it's not so much the jawline for anesthesiology, but it's the comforting. Like, do I feel comfortable
Yeah,
around
for sure.
you?
Yeah.
And I feel comfortable around you.
Did you apply to only categorical anesthesia programs? Because I know they're like the people that applied to anesthesia also applied to prelim years and TY years.
There was only a couple that I applied to that were advanced.
Okay.
So
Yeah, that's phasing out. It's more like
it's
like Josh
almost
was
all
saying, it's like
categorical now.
90% of them are all categorical.
Yeah.
now.
Okay. I just was thinking that would make it even more complicated.
yeah.
No. So
So-
you applied. So what did you do with numbers wise? How many ortho programs
Yeah.
did you apply to? How many anesthesiology programs?
So with anesthesiology, I just kind of hedged. I had to have a backup. I thought I was a very competitive applicant on paper. I'm sure, like all of you guys did, you go on the ERAS or the AMC, and you can plug in your stats.
Yeah,
and see
and you can
odds
see
of matching, and of
or
course,
residencyexplorer.com.
and they're
.org.
high, and they're this. But I've heard just so many stories of friends of ours that have just insanely, and even online, incredible applications, and for whatever reason don't match, whether it's orthopedics or anything else. And I just wanted to hedge my bet because it didn't really, cost anything. Money, yeah, but like in terms of increased time stress of dual applying, and I just wanted to hedge just in case something happens.
When you say money, and this is a good point for people to know, I think this is a good point to point out. Spend the extra money for the apps because like having a year behind will put you behind a year of physician salary, unnecessary stress,
There's a lot
applying again. Go all out.
There's a lot of things you can save money on in medical school, not take out as many loans as you can, et cetera. Saving $1,000 or even less on having 50 more applications or whatever is not the one to save money on.
Yeah.
I say this for med school too. Go all out one time.
Yeah.
One time, make it so you only have to apply once.
Don't go overboard. Obviously, there's a point of diminishing returns for each applicant.
Yeah.
But, don't limit your list just because of money.
Yeah.
Yeah.
So that's why I did it. I was like, look, things can happen. I'd be very, very happy to be an anesthesiologist. It's something I'm very interested in. So I was like, let's dual apply just in case things, don't turn out and I don't get, whatever these 15, 20 interviews, whatever it is. And I didn't. And thankfully I did dual apply. Because like I said, I've known people, and I'm sure people listening have also known people that are very competitive applicants on paper, great interviewers, but just the way sometimes it shakes out.
Yeah.
It's so random, some of the interviews you'll get places from that you're like, why did they give me an interview but this one didn't? So it's
same. I did not get, the place I thought I wanted to go locally.
Yep.
And then I got a place that I thought would never even look twice at me, and that's where I'm going.
It's
You never know.
so random. You can be the best applicant on paper, but sometimes it just doesn't shake out because orthopedics, they have 1,000 people apply for 60 interviews and then 5 spots. So like those 60 people, like the difference between, the 60th person and the 100th person is still so razor thin, and it's so random, and just the odds of it can shake out where you can be an amazing applicant and not get as many interviews as you desire.
I 100% agree. And even when I applied to 53 internal medicine programs, had 15 total interviews. Those, that difference of 30, 40 programs, there's nothing statistically about me that I shouldn't have gotten an interview, but I didn't. And I think, Sam and I talked about this before, is that there's something on your application that people see and they're like, oh, we would like to interview this person.
Yeah.
Or they see your application and they're like, meh.
This person just wouldn't fit with us.
Yeah.
Yeah, exactly.
Like, that's the thing. It's not that they think you're meh or whatever. They just go, this person, not going to fit in our program. Historically, we like people with square jawlines. Or whatever it is, know?
And
So other orthopedic applicants I talked to, they're applying to every single program. They're applying to 120. Did you do that?
I under-applied.
Okay.
And I under-applied with
It worked out, didn't it?
I applied to, I think, 80 programs.
Oh, that's
and
an
that's
under app.
That's
Okay.
under, apparently, for this year.
Gosh. And how many anesthesiology ones?
Only like 15 or 16.
Okay.
So close to 100 total programs.
Yeah,
gosh.
there's about 100
Okay.
total programs. And so with orthopedics, and again, going back to the away rotation, this is why it's so important, because with ortho and for every specialty, but I think especially orthopedics, is they love fit. And it's so hard to come across on a virtual interview, and I'm sure it's the same for internal medicine or every other specialty. That's why these away rotations are so great, to show them who you are, so you're not constrained to that hour-long interview, that 30-minute interview, whatever it is. So it gives you a huge leg up. So I applied to 80 orthopedic surgery programs, and I got 8 interviews.
Okay, great. That's a 10% return on your investment.
Which is from what I've seen.
And from the charting
talking to
outcomes,
people,
what is that? What was that? You know, the NRMP charting match outcomes. What was that? What was the magic
so
number?
So if you did like
ortho?
8 in a row?
Yeah, or because you know that they have that
You're
magic
talking about
number.
the point of diminishing returns. Where
No. The point of where, you know, they say, 90% of applicants with 8 contiguous ranks, they match.
Yeah. So the point with that was back when there was in-person interviews. So they were more, I mean, it was more spread out, or I don't know how much that really had a role in it, because more people got interviews probably when they were in person. People were dropping more. Yep. So based on the 2020 data, it was high. It was like 10 or 12.
Okay. Which means it's probably even higher for a virtual season.
It was probably even higher.
Information we don't have yet.
Yeah, it was probably even higher, but what I've noticed that 8 this year was about the median.
Wow.
About the median. It was, from what it seemed like, 8 to 10 was probably the median in interviews that people were getting. And I think it was because those top 20 applicants were keeping 30 interviews, so there was less for everybody else. So I think the median interviews was a little bit lower this year.
But ortho still filled all the spots.
It did.
So
of course
they did what they needed to do, I guess.
Yeah. And then anesthesia, I had, I believe, 5 interviews, so I had 13 ranks.
Okay.
I did. I mixed it up a little bit, though, because there were some anesthesiology programs maybe that I would have liked a little bit more than some orthopedic surgery programs.
Okay. So you just sort of, you let fate take over.
I let fate, so that's why when I was up on the stage, I was like, oh my God, I don't even know what specialty I'm doing.
So on Monday, we find out we match the Monday before, the Friday, the match day. I mean, you must have been obviously relieved, right? Everybody's relieved on Monday they matched. But you also go through this whole week not knowing what you're matching into.
what type of doctor you're
And they're
gonna be.
asking us when we're doing these simulations.
I know, and I'm
these
like,
things. You're like, I don't know.
Yeah.
Either this or this. And then and then we talked about how you went up on stage.
Yeah, but so I would say, the away rotations are just so important, and just make the most out of all your interviews that you have, because it really only takes one interview for you to rock.
Yep.
And you're set. 1 or 2. I mean, I don't know what's going to happen with orthopedic surgery in the future, if they're going to go back to the in-person interviews or anything, but just there were so many great people who didn't have a chance to interview at some places or match, and it's just so unfortunate. And I don't know what the future holds in that regard. But,
just for a minute, something you said a few times, if you had walked up on stage and saw you matched to your favorite anesthesiology place, how do you think you would have felt? Would you have been satisfied?
I would have
disappointed?
been absolutely thrilled.
Yeah,
I really would have been.
He'd be thrilled with anything.
I would have been thrilled because a big reason is I saw how brutal this match process can be to some people, and to just be fortunate enough to match in a place that I liked and I interviewed at, and in a specialty that I still really do enjoy. Like I said, I like everything. I would have been thrilled just for that opportunity to still match at a place that and get me to be a board certified physician. That's the most important thing at the end of the day,
I
right?
think you would have been thrilled with pathology in Alaska. Like I don't think you would have.
That's where he draws the line.
Such a
I don't know
positive
how
attitude
my girlfriend
about
would have
it.
thought about that.
It would have been a
But
fun adventure. I think.
Oh, yeah.
I think you would have been like, okay, you would have taken 30 seconds to compute, and then be like, you know what, this is gonna be a fun adventure. I'm so excited to
I do
learn all
like-
these different
Always wanna
pathologies.
go to Alaska.
I can go snowboarding.
No.
Yeah.
I just feel like you'd see the positive side of it, and I think
Yeah.
that's why. Yes, you got your number 1 rank, but I am pretty sure you were number 1 or ranked to match at almost, probably everywhere you interviewed.
I don't think so.
No, because it's a positive outlook. It's extremely important. It carries a team very far.
Yeah.
It's
Agreed.
very important.
I think I really just want to touch on that, because this is something that's lost on a lot of students, myself especially, is that you kind of envision yourself in one field and nothing else. And you're trying, like, especially for me, for a lot of students that had to decide between 2 different fields, it's very, very likely that you would find a happy, successful career in more than one field. And that there are things that you would like about other fields. Like, had I gone emergency medicine, I would have found happiness and I would have found success in that career, although it's different. I could have seen myself doing OBGYN or family medicine even. Like, I don't think that you should worry so much at the end of the day, because like you just said,
Don't box yourself in.
Don't box yourself in, but just
unless
don't
it's
be
general surgery and you're me.
just don't be so
cool,
worried about that decision, or don't feel like there's only one field at the end of the day that would ever suit you. It's not true.
It's not true. You can find happiness in anything that you do, and I'm so lucky to have matched into orthopedic surgery, especially coming from a new school, which I think did have its challenges because, like I said, I think on paper I was a very good applicant, and some of my colleagues in medical school too. I mean, going to a new school did have its challenges where you really do have to, kind of explain, like, oh, I'm a new school in Fort Lauderdale. It's the MD program.
Did they ask you specifically about that?
I did get a couple of questions on that where somebody's like, where is this? And
I did too. I was asked where my COMLEX scores were.
Yeah.
Because, we have our osteopathic program that's been around forever and is very well, known. Couple of programs, local programs too, were like, oh, where are your COMLEX scores? We don't see them. I'm like, I'm part of the MD program. Like, oh, we didn't even know.
Yeah, so those are one of the challenges, but I hope in the years to come we put out a good name for ourselves, just as students, when we do rotate at these places and put out a good word for NSU MD and just continue to grow. But like we said, we knew what we were getting into when we were the first class to do this, but I think it did have its challenges sometimes, and maybe I could have gotten a few more interviews if they knew about our school already. But that's something for you to take to heart. And when they did ask, why did you go to a new school, I mean, it let you be a leader. I had opportunities to give feedback and be the first in something and take a chance. And if you can spin it like that because it's true, they're gonna take that and say that's really nice. We like that.
I'm biased because I love our class. Just we've gone through so much together, but like even just you matching orthopedic surgery at the Ohio State University, like that's something. It makes me happy. But these matches this year, regardless of how competitive they are or whatever, those translate into our reputation. Those give our underclassmen. They contribute to the reputation is what I'm saying. They're like, oh, yeah, somebody did match plastic surgery, orthopedic surgery, internal medicine at this place. And that opens doors in a way for some programs where it might have not otherwise.
Exactly. So just keep putting the word out. And like I said, I think don't let going to a new school or however you view your school is, don't let that constrain you. Like, you have other data points, and we all, at the end of the day, we all learn the same stuff anyway. It's just sometimes people view reputation, whether that's right or wrong is a different debate, but you get your away rotation, be you, because at some point they're going to say, oh, I could take this guy who's really cool, but he goes to a lesser known school or that's newly established, or this guy goes to big name, but we don't really like to think, which one are they going to take?
Always you.
They're going to take the one that they can be in the trenches with in any specialty.
Right.
So do your away rotations, especially in orthopedics, because interviews are just so hard to come by, even if you have the most fantastic stats in the world. Do them. You're interviewing them, and they're interviewing you. Just be you, and just be somebody that they like to have around. You don't need to be the smartest kid. Just be somebody they like to have around, and then hope for the best.
And work on the jawline. Chew gum.
There are things out of your control, like the jawline, but there are things.
Oh, you can work on the jawline.
There's things in your control, mostly just your academic performance, like through your discipline and through how hard you work and your study habits, and then there's just how you carry yourself. And I think those are the two things that you can control, and everything else is kind of out of your hands, at least once you get to application season.
And one fun fact about orthopedic surgery, because I know it had a 20% increase in applications. Everybody wants to do it. It's cool. It's super cool. You get to use drills.
And hammers.
But the physician workforce data came out from AAMC. And on average, nationally, 56% of orthopedic surgeons are over the age of 60.
Yeah. So
there's going to be a huge need for orthopedic surgeons. So they might even... It would even maybe be smart to think about opening programs. They should open programs. And the same numbers for cardiologists as well, Mitch.
Yeah.
So it's just very interesting to look at that data and see where it's going.
When we did one of the projects I was on, we were looking at like physician shortages or projected shortages in each specialty. We didn't look at surgical subspecialties, but general surgery, I believe, was the only one where like the ratio of surgeons to population was going to get outnumbered like quite a bit, and that we were going to have a pretty severe shortage of general surgeons in the near future.
It's of nearly everything. We always say primary care, and that's true, but there's these other things too. There's orthopedic surgery, which you need with an aging population. So maybe some spots can expand out. Maybe they can make more programs.
There's so many seats. Just incredibly intelligent, hardworking people that don't match into any specialty sometimes. And that would be amazing to have more orthopedic spots or increase the size of programs too. I think. I can only speak from my perspective as a medical student. I'm not a resident or attending or anything, so I don't know their viewpoint. But at least from a medical school standpoint, medical student standpoint, and just knowing some people that didn't get into orthopedic surgery, it would be incredible to have some of these students learn and
as a member of the general human population. I would like there to be more orthopedic surgeons, because if over half of them are over 60 now, by the time I'm going to need my knees, we're going to have an orthopedic surgeon shortage.
And
so
I think it's crazy too. They're absolutely just filling or they're just expanding the amount of residency slots in fields that don't need it, like emergency medicine. Over 200 unfilled spots, and just a massive influx of new EM residencies, often in places where they really shouldn't be building EM residencies. And then you have things like urology, ortho, plastics with close to 50-60% match rates. That's the places that actually need the residencies.
And with the physician shortages too, projected shortages. So very interesting. I guess maybe it's easier to start an EM program than it is an orthopedics program.
Probably way easier.
I imagine.
I'm not sure how that works.
I imagine orthopedics has to be funded.
Do you have an ER? Oh, all right.
Perfect. Let's put some people in there.
So interviews went well for you overall.
Obviously.
They went.
Guy.
Like I said with the away rotations, yes, they're interviewing you, but this is just about where you could see yourself work. Don't put yourself in a position that you won't be happy with just for the sake of, matching at a place that you think is more prestigious or something. Whatever you think it is. You're interviewing them too. So sometimes there were interviews that I felt like that's why we re-rank, that I don't think went as well, that I couldn't see myself matching in. So
same.
I think the ones at the top went well, and the ones at the bottom, I was like, I'd be happy obviously to match no matter what ends up happening, but that's why we rank things.
And you don't have to. It's different for depending on what you're doing. I did IM. There were a few programs they just didn't rank based off of interview. I was very worried that I didn't do that going into that Monday match day because I am a worrier. But yeah, if you don't see yourself there, don't rank it. This might be different for certain specialties.
I think it depends. Yeah,
it just depends.
If you only interview at let's say you interview at a total 8 places, total.
Yeah.
And you're I don't even know if you have the liberty to not rank them.
Yeah.
Because you're. I just want to put the disclaimer out. By not ranking something, what you're saying is, I would rather go unmatched and potentially soap than go here.
And this is how I was going to finish my thought was.
Yeah.
I went in with much anxiety for that. And I interviewed at 18 places. I ranked 14. And Mitch probably remembers me massively freaking out, because I wouldn't. If I could go back in time, I'd rank those other 4 just for the anxiety relief. Because going through soap, that's the worst.
It's also not hurting anybody.
I haven't done it yet. It doesn't hurt me to rank it, but I can't even imagine how that must feel. It's a miserable week. Your whole class is celebrating around you. You're not. And it seems like your whole 3 years leading up to this point were for not. So
that's why I'm saying too with orthopedics, and if you do a more historically competitive specialty, think about dual applying. Because if I dual applied and let's say I got more interviews than I knew was a pretty confident I would match orthopedics, you don't have to take any of those interviews that you applied to for your backup specialty. Hedge your bet unless at the end you would rather soap and do it again to do that specialty you desire. It doesn't hurt to have another specialty that you can potentially interview at. And you can always say no or not rank him. Yeah.
It's a good point because, had you matched anesthesiology, I know it's probably technically possible to then somehow reapply to ortho a different year. One, it's extremely unlikely, and two, when you match to a categorical program like that, you're committing to filling that spot for those years to become that type of doctor.
Yeah.
All right. Well, one thing I wanted to talk about too before we wrap up shortly is, could you just explain generally for those who are interested how orthopedic programs work? Like, how long are they? What type of career options do you have? And like, what are the fellowship pathways after those years of orthopedic surgery?
Definitely. So orthopedic surgery is a 5-year categorical program. And your first year of residency, your internship, you do only 6 months orthopedics. And then the other 6 months is, rotating around. You'll do like SICU, ED, radiology. Some places you will do like an anesthesiology month, general surgery, plastics, burn, whatever. Every program is different between those 6 months that you do your intern year.
Do any of them have you do wards like internal medicine?
I don't think so.
Okay.
I don't think so. I mean, I know for a few of the programs you do SICU for like a little bit, for a month or so.
That's really important, though.
Yeah.
And you do ED, so.
Yeah, and you do ED.
Yeah.
You do ED at some. Some are heavier. Like some programs that I interviewed at, they do those other 6 months are just straight gen surge, and then 6-month ortho.
Wow.
So you're really working hard your intern year. So your intern year, generally, you don't really do a lot of independent solo call. You're there to learn. You're there to learn the process and kind of just learn how the department works. Your second year, historically, from what I've seen, what I've heard, again, not a resident, has been the most taxing in terms of hours because you're the youngest on the totem pole while also being able to handle the most. It's really that happy medium where you're doing solo night call, you're doing solo weekend call.
I love that you called a happy medium.
Well, I mean, it's
See, that's
because
his
they don't.
outlook. It's positive.
They don't
It's
want
so beautiful.
an intern there. The only
Yeah.
one in the hospital is our intern. And at night, you're like, okay.
No.
Our second in the second year historically is when you the second and third year when you start to take solo call, and being the one there, and then it gets a little less taxing apparently from fourth and fifth year on the actual call schedule. So your first, it's very front loaded. It seems like orthopedics. Again, haven't gone through it, so correct me if I'm wrong. But from the outside perspective, that's what it seems like. And then you go through rotations in things like trauma, which historically is the most hour heavy. Sports, joints, foot and ankle, oncology, and pediatrics. I think are the 6. I probably am forgetting one, but those are going to be your 6 main, and you rotate through those. And you do a 2.5-year curriculum, so 2.5 with all those, and then you kind of repeat it.
Oh, wow. Okay.
So you kind of do everything twice. At some programs, instead of doing 3 months and then 3 months of something like pediatrics, they'll just do 6 months straight of pediatrics, and that'll be your pediatrics. And then just to touch on the fellowships really quickly, most residents that I've talked to do fellowship because it's only 1 extra year, and then you have that certification, that board training, that extra training for life. So you can do everything I talked about. It has a fellowship, trauma, sports, foot and ankle, joints.
I think that's becoming
Spine, right? You could
Spine.
do spine.
Oh, spine. Yeah, so that's
Yeah.
another rotation that I forgot to mention. Okay. Spine. Yeah.
Because that's something I didn't know, and I had to look this up, is you have a herniated disc. Do you go to an orthopedic surgeon or a neurosurgeon? I always thought a neurosurgeon.
You can do either one.
And you can do either one.
a lot of overlap there, huh?
There's a lot of overlap, and when people rotate on wherever they go for orthopedic surgery, that and hand is another specialty that I forgot to mention.
Yeah.
Is split between plastics and ortho, and then spine is split between neuro and ortho.
Okay.
And different hospitals have different ways of splitting that up. Like sometimes we'll say if there's a neuro deficit, neurosurgery is taking it. Other hospitals I've been at where it's split in half for the first 15 days of the month. If somebody comes in with a spine complaint, ortho's seeing it, and then second half. And then it's same for plastics. So if it's the first half of the month, then that's the plastics team seeing hand. Second half, it's the ortho team seeing hand.
There's a lot of interesting overlaps like that in medicine. I can just think of the top of my head, like interventional cardiology and vascular surgery. They can both treat like peripheral arterial disease. Anesthesia versus ED, managing like trauma airways.
Yeah.
Podiatry and foot and ankle orthopedic surgeons.
Yeah.
I'm sure there's overlap there too.
Yeah.
It's pretty interesting.
Yeah, so that's just how it works. But you can do a fellowship in that. You can do ortho and then fellowship in hand, ortho fellowship in spine, sports, joints, foot and ankle trauma. But yeah, it's recommended. Oncology, you can do a fellowship in that. because it's only one extra year. And I mean, considering the other surgical subspecialties that are longer than 5 years, ortho's a good deal. I mean, 5 years is a long time, but I mean, it's less than vascular, than plastics, than neurosurgery, than any of the urology, or I think urology might be 5 years too, but than some of these other surgical subspecialties. So it's a good deal.
Yeah, 5 plus, or plus 1 or not for a fellowship. That's not an entirely too long time to be such a specialist in your field.
Yeah.
Cardiology, I'm looking at 3 of internal medicine, 3 of cardiology.
Exactly.
Then your general cardiologist, then it's 1 or 2 years. So that's up to 8. It's a long time.
Yeah.
Wow.
So yeah.
And you like now you've hit the reset button. You like it all.
I like it all.
Okay.
I was fortunate to rotate in a lot. I mean, joints is cool. I mean, you do similar procedures all the time, but there's something to be said about perfecting your craft. Like you do hips and knees, and you are the best at it. Or you can do something like trauma, where you're doing a humerus and then a femur and then a tibia, and like all on the same day. So it's just what you like, and I'm sure as you go through residency, you find out more about that.
If you do joints, let me know.
Okay. Hip replacement, knee
Knees,
replacement.
probably, yeah, knees.
Yeah.
Ortho is one of those interesting specialties where, let's say you are like a shoulder guy, like that's your specialty.
You're a shoulder guy, yeah.
Like you're the shoulder guy for
Shoulder
your
expert.
area.
Yeah.
Like, and I know some places it's even hyper specialized where they have entire surgical centers that are like just for hips or just for whatever.
Spine, yeah.
Yeah, and then
Don't-
that translates to becoming so efficient. And if your team only does that too, and you work with the same team, your efficiency for the number of patients you can see goes way up, which, I mean...
Yeah, especially in things like sports and joints. I've seen surgeons, that can knock them, like, bang, bang, bang.
And
throughout
that probably
the whole entire
helps
day.
the patient and you, because, like, the patient, one, you're working with somebody, that's all they do, so they're probably really good at it.
Yeah.
And then you're probably having a lot more revenue and efficiency and time off because you're able to see more patients in a quicker amount of time.
I
Yeah.
see commercials for spine places all the time, and that they're 15-minute surgeries. So,
Holy
yeah.
crap.
I don't know about that.
Oh, I
The
see 'em
spine
on
surgeries
TV,
I've
yeah.
been in are like 8 hours. And,
oh no,
yeah.
I'm like the micro discectomies. Is that how you say it? Yeah.
Microdiscectomy.
Yeah. Oh.
Yeah.
I don't know, I'm not a surgeon.
Yeah,
I'm not a
but-
surgeon.
No, I mean, that's the cool part about ortho, too, that, I mean, you're really attracted to me. When you are practicing, attending, there are different avenues to schedule your work and do work-life balance. And if you want to work in a private practice center and not take call, you're free to do that. If you want to work in a hospital and be in a more academic setting, you're free to do that. So it's really cool.
I gotta say, Kyle, you are, not my son or anything. But I'm so proud of you. I really am. I'm so impressed. You're from day one. I
All right, you can say
knew
that,
you when you're
yes.
talking about your Chick-fil-A. I voted for you for president, just
Thank you.
FYI.
Thank you.
Which you should have won.
Yes.
You're fantastic.
Controversial moment
Thank you.
Controversial
in
moment.
SUMD history.
That was beautiful what you did.
Thank you.
But just seeing your trajectory,
Mm-hmm.
having groups with you, seeing the way you think, your positive attitude, and seeing you open that letter on stage, it was such a proud moment. I was so
you.
happy for you. And your mom, she was so excited. So I'm really looking forward to what your career has in store for you.
Thank you so much, Sam. It's been a pleasure to be here and talk to everybody and hopefully, give some good advice to some people who are considering orthopedics and
Yeah,
go for it.
You're going to do great things, man.
Thank you.
If you could give just maybe one piece of advice to anybody under us, particularly here, just any
Or to
advice.
past Kyle.
Sorry?
Or if you're giving it to past Kyle.
Oh, the past guy.
Yeah,
if you could
Kyle
give
for
yourself
years
in the
ago.
past advice or an aspiring orthopedic applicant, just a tip of advice before we head out here.
Okay,
Any
so
idea?
an aspiring orthopedic applicant is academics are important. They get you in the door, but your personality and who you are gonna close the deal and seal your fate. So keep that in mind. Use your academics and research to get you in the door and something to talk about, but be somebody that people really want to work with, and that's the most important advice I can give.
Absolutely.
Be yourself. Work on personal growth. And I think that's
Yeah.
something that a lot of people leave out from med school. But even myself, I'm old, and I still have grown so much as a person over the past 3 years. And I've
Yeah.
seen my classmates do it too. Go from 22-year-olds to full adults, 25-year-olds. And the amount of personal growth that can happen in those 3 years is incredible. So focus on that.
Exactly.
And don't forget how big of a gift it is to even be here.
Yeah.
It is. Medical school is is hard and it's a blessing, and you'll get through it and just do something that makes you happy.
Did you have fun over the last 4 years?
There were challenging times, but it's something that you can look back and say it's the most fun I never want to have again.
That's the best stuff.
Yeah. So, yeah.
I wouldn't mind doing it again. I thought it was fun. But I mean, I love med school.
Nerd.
No, I think it's great.
Kyle, thank you, man. It's been really a pleasure getting to know you more and getting to talk to you. And I'm sure that this is going to be super helpful for future ortho bros and gals.
And if there's any future students who ever listen to this, whether it's a year from now or 5 years from now or 6 years from now, I'm hoping they'll be able to reach out to you.
Definitely.
They'll find you. His name's Kyle.
Yes.
He's part of the charter
Reach
class.
out through our little NSUMD network of
Yes.
people.
Yeah.
Definitely. Well, thank you, Mitch. Thank you, Sam. It's been an absolute pleasure, and I hope I can help some future students.
Thanks, man.
Orthopedics on sink or swim, and we're playing you out today. And we're playing you out today. Do you need a knee replacement? Call Kyle in 10 years and he'll do it. He's gonna do mine. I'm super excited. Sink or swim.